My name is DrRic Saguil.
And action. Hey, Jay had a... This is Kirk to them.
Stress and that's to cope with it.
And action. Hey everyone, it's DrRic. And today's Minute Clinic is from Fran. So Fran had a question about what to do with high blood pressure. And high blood pressure or hypertension. I have done a couple of videos on white coat hypertension. So check them out. I'll put them down below. And I have other references, so we'll get to that in a second. If this is the first time you're finding me, hit the subscribe button and the alert button to find out when I do new videos. Also, send this, or like it if you like it, or thumbs down if you don't like it, but send this to other people that are also struggling with hypertension. My DOT guys, it's terrible because they have to get, they have to pass annual to every 2 year a physical exam. And sometimes, especially when you go to a doctor's office, just going to the doctor's office will drive up high blood pressure. But that's why a good doctor will always say outside the office, if the blood pressure in the office is high and it's repeated and it's still high but going down a little bit, the good doc will usually have you check 10 blood pressures outside the office, maybe vary the cuffs, go to Julasco, go to Meyer, go to the pharmacy near you, Walgreens, Target, and get a bunch of different numbers, different times of the day. I would usually say when you're pissed off or tired, because that's the best time you know that your blood pressure will indicate whether we have a problem or not. Because blood pressure is just a silent marker. And if you think about it, so are blood tests. But if the silent marker, or the blood test for that matter, show that we have a problem, you might be going into the wrong direction. Instead of living till 90 to 100 without any medicines or surgeries and doing well, you might be looking at disease. And disease nowadays usually doesn't mean you're going to die. It means you're going to persist on, but in a vegetative state or just stuck in a wheelchair. And that's not a good life. So what I'm trying to do is prevent all that stuff. So don't think that if you're not feeling any symptoms, you're healthy. Look at your waistline, look at your other parameters. So anyway, so let's get into it. I have 7 things that will get you to lower your blood pressure, and hopefully if you have been worked up. Now I have to say this first. If you've been worked up as far as aortic stenosis, renal vascular narrowing or stenosis of the renal artery, problems with inherited disorders, if you've been worked up, cool. If you haven't been worked up, you really should get worked up first, and that usually starts with a primary care doctor and then maybe a referral to a cardiologist or a renal specialist. There are certain things that can manifest in a short amount of time and really lead to something disabling, so you want to make sure you don't have those. But for the majority of you, it's going to be lifestyle, and for a small percentage, it'll be genetic. So finding the lifestyle that will balance and get your blood pressure lower, though, is the trick. And that's what I want to try to encourage you to do today. So, having ruled out any big diseases, first thing I would do is read the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. And it's kind of boring, but I think I did do a video comparing the DASH to the Mediterranean. But the biggest thing with the DASH is this. It's limiting your sodium intake to 1,500. That's not just the only thing. But limiting your sodium intake to 1,500 milligrams per day. Now, if you take a look at, where's the sodium here? Here. Sodium here says, what does it say? 115 milligrams. So, 115 milligrams. And if you look at the serving size, it's 7 chips. I don't know anybody who stops at 7 chips. I definitely don't. I could probably, this is not mine. Yeah, I started in the cafeteria, in the dining area. And I thought, oh, this would be a perfect idea to do. And it's festive. Nowadays, everybody has chips and guacamole or salsa for their appetizer and then their dinner. Last night we ate at Andy Wiles True Foods in Oak Brook, and it was a bit salty. Sorry, Andy. But there was a nice kale avocado dip, but there were chips, pita, that we had before the dinner. And thank God that the chips were on the plate and there were a limited amount of chips because I can't stop. That's my weakness. So this, if you have continue to have a handful, especially if you're watching a game or show, if you go past 7, every 7 thereafter, so 7, 21. So if you keep on adding it up, say, for example, you finish off 70 chips, which could be possible per in a bag. There's about 16 portions per container. There are 16 servings per container, so that means 7 times 16. So it's not that far off. If you keep on eating this, especially if you don't have any dinner, this is all you have, and alcohol or a pop, I think that you can easily get to 1,150 milligrams. So 1,500 milligrams is the recommended top out for the DASH diet. So if you wanted to see what the DASH diet was, check out the video I have below. But this is the handout you can find on, there's like 68 pages, but there's a shortened version too. But read through this, it's a little boring. Big pictures though, like this big picture, which is nice because it makes you look at big pictures. But there's bullet points of success that you might be able to. So if you're that percentage of the population, all you have to do is lower the sodium and increase your potassium, maybe increase your magnesium, then you'll respond. So I think it's worth it because a lot of the basics of the DASH are also found in the Mediterranean diet, and the Mediterranean diet is pretty healthy. It's more of a way of life than anything, but this might get you to turn around without a problem. And if you were one of the lucky ones that responds to that and your blood pressure goes down, cool. If you're not, then we'll move on. So check out my information on DASH and the Mediterranean and low salt. So the next thing you do, in addition to changing, this is all lifestyle change now, except for the bottom, but in addition to changing or being aware of the food you eat, I don't care what age you are at, but especially if you haven't hit the right BMI, I'll talk about that later, body mass index, it'd be worth it to try to lose weight. So sometimes your sweet spot will just be 10 pounds off and then you're good. So also get active. And walking is not active. It's good as a basic activity of a human. Walking, squatting, jumping, balancing on one leg, lunging, reaching, all those things are important to do. Getting up from the floor. If you can't do those things, then you might have to have a coach design an activity for you. But I say get active in the form of playing sports, going and joining an endeavor more than just walking. I think walking is fine. But again, the old idea about walking, and I have a video on steps per day. I forget what the name of it is, but I'll try to find it and put it in the link down below too. Steps per day, the 10,000 steps per day is a basic minimum, just because I think Japan came out with a pedometer of sorts, and they just arbitrarily picked 10,000 steps as a goal for their pedometer. Good for them. But there isn't anything else that bases its findings on how many steps per day. I think you should always keep active. But I have a lot of people that work in a factory or work in a hospital that are walking back and forth all day, and they're still having problems with high blood pressure. So I think exercise, working on breath exercise, and usually you do breath exercise when you, say, do resistance exercise, or when you do band work, or when you do CrossFit. I think it's important to build up muscle, especially before you get older. If you're already old, like me, 57, going on 58, it's never too late, but you might have to be having or hiring a coach, physical therapy and or athletic trainer or Coach Rick. So get active. And I say 3 times a week at the least, from moderate to intense activity if tolerated, and don't just jump into that, work your way into it. Maybe 60 minutes on the weekend to give you a little bit of de-stressing too. And that's where this next one comes out to, reflection or recitation. The reason I put those two things, I was trying to think of something to say with an R. Reflection is just being in the present moment and developing that skill that gets you to practice present moment awareness. And a lot of you will just say, what the heck does that mean? It just means that you have to not really concentrate on everything in the future and not always dwell on things that happened in the past. It means that you just have to be observant. Anxious people will usually be observant, but they'll react to everything they observe. There's something in traditional Chinese medicine called monkey mind. I think it's actually in Indian medicine too, Ayurveda. Monkey mind is the brain is always going to be thinking, and it's the beauty of what we do as humans is we think. But sometimes when you react to every thought that comes through, and I think it's 3 thoughts per second is the average. Unless you're anxious and you have like 6 to 10 thoughts per second, and that can be a whirlwind of activity. But if you react to every thought, then you'll induce more thoughts on the first thoughts. And sometimes it'll escalate to the point of, for example, I have a chest pain issue. I'm not saying that I do, but just as an example, oh, that smarts, that's a chest pain issue. Wait a minute, I might be having a heart attack. Oh yeah, I'm gonna die. Wait a minute, who's gonna take care of my kids? Wait a minute, what happens with, I didn't submit my life insurance. So you can see the escalating things, the complications that develop just from one thought. So sometimes if you just learn to observe the monkey instead of react to the monkey, then usually the monkey, in old school techniques or thinking, the monkey will calm down. So, but that takes practice, and that's usually meditation. If you don't meditate, then just reflect. Sometimes sitting in a church pew or temple will also get you to reflect. If that doesn't resonate with you, sitting on a park bench will get you to reflect. And turning off your phone, because a phone, if I scroll down Facebook, it's like, ooh, that's an idea. Ooh, that's weird. Oh, what happened there? It's like the faster you scroll, the more information you get, then the more reaction you're going to have to that. So you click on something, you click on something else, you click on something else. That's monkey phone, monkey mind, monkey phone. But if you learn to get that away, or not react, maybe even not even open that, then it might lower the blood pressure. Recitation is, it's a mindfulness, but it's in the form of getting a mantra to repeat over and over again. Sometimes you can do it with beads. These are mala beads that just work for, it's not religious. It's just a way it's a mantra that was given to me by Deepak Chopra, and I repeat it over and over again twice a day. I only do it for about 5 minutes in addition to my breath exercise, but I think it's important, and it helps me because of the going through 104 beads, or the rosary, for example, in Catholic religion. Going through the rosary will get you to repeat prayer over and over again, so that even though it's it's built into the mind, you don't have to think about it, but just doing that, saying it, going to the next bead, rolling the bead, it keeps you busy so that you're concentrating on that instead of concentrating on the monkey in the room. So these are important. If you can't fathom doing your own reflection, or the brain is just too wired, then you might need a coach for that too. So maybe a coach for movement, activity, exercise design, maybe a coach like a psychologist for calming practice. There's other scientific methods like cognitive behavioral therapy, or EMDR, help to also link the brain and slowing down thinking to a movement of some sort. So please consider that'll help lower the blood pressure too. Just if you've ever been in a massage chair or a massage bench, it's not just a physical activity of somebody calming you, it's the healing and the great response you get just from relaxing and breath. A steam room, you just sit there and it's like, oh, this is hot, but oh, I'm feeling comfortable. So there are benefits to this that you probably weren't aware of. And that if you do that long enough, it will keep your blood pressure down for at least 12 hours, even longer when you get into it, but you have to start somewhere. Next would be squeezing out an extra hour of sleep. There have been studies, and I think I put them on my cancer video, studies that show the difference between 8 hours of sleep and 9 hours of sleep increases the chance for breast cancer recurrence. So just if 1 extra hour per day, and I don't do 9 hours, it's hard for me to do that. I actually get to sleep or start to fade at like 8, and I wake up at like 4 or 5. Today was late, like 5:30, but that's my routine. So I can probably get more, but I just have so much stuff to do that but my blood pressure is okay. So if you're having high blood pressure, squeezing out an extra hour might be what you need. And how would you do that? Maybe CBD at night, maybe magnesium, Magmind by Yarrow brand at night, maybe calming practice at night, soothing lotion, warm to cold, a warm shower to a cold room, just to lock in that mentation of going to sleep, turning down the brain. melatonin at night. So there's a couple of different things that would help, 5-HTP, L-theanine, but it would be important to try it for about 3 to 4 weeks. It's just doing it one night won't bring your blood pressure down the next day. So you have to practice. These are all meant to be practices, lifestyle changes. So if you haven't done these, which probably most of you haven't, it'd be worth a try. Doing all these things at the same time, I'm not sure which will be the true winner, the true thing that changed your blood pressure. But hey, listen, there's no side effects to this. So we'll get to the side effects later of the other things. So cutting out alcohol, I think, is really important. I think alcohol works to calm everybody, and it's so much a part of social engagement, interactions, that it's hard to stop. But I think giving yourself just on holidays alcohol and maybe that daily or that weekend alcohol intake can still impact blood pressure the rest of the week. So I might challenge you to do 3 months of no alcohol, just on a holiday perhaps, and see what that does to you. Not only will it decrease your calories, it might give you, like tyramine in alcohol, in beer, will jack up the blood pressure. Most of the things in wine will be okay. It's just the alcohol content itself that sometimes lowers blood pressure first, but then raises it later. So those of you, and it also screws up sleep. So those of you who don't have a problem with alcohol and you have a nightcap every night and you're on blood pressure medicine, I would say that's a trade-off. So challenge 3 months off and see what you can do. And if you need something to relax, I'd rather have you take CBD or medical cannabis. So no calories in that, and it actually lowers the blood pressure. So alcohol initially relaxes, but later on it can cause problems with mood. And again, the liver clears alcohol out because it's a toxin. It's the only thing that's removed from the body at zero order. So I don't want to get into that, but it will leave your body in about 6 hours. So if you used it to relax, in 6 hours you ain't going to be relaxed. And that usually is like 2 in the morning you wake up, either to pee or just your senses and your heart are pounding. So cut it out, just as an experiment. And if you're addicted to alcohol or you have a substance abuse issue, then you might want to see a professional before you just cut it out completely, because it can be a withdrawal. Delirium tremens can happen, that's seizures. That's how potent this stuff is. It can cause you to seize if you haven't had it in a while and the body's used to it, and you're not going to be happy for a short time. Cutting out stimulants like caffeine, I think, are important. Caffeine can be in coffee bean. Caffeine can also be in Red Bull. Caffeine can also be in 1 hour energy. And I think that you have to be careful with the 1 hour energy because there is sugar in that. Even the sugar-free and caffeine-free stuff has herbs that just don't declare themselves as caffeine. Guarana extract is actually a stimulant. So you got to be careful. If you're using that because you're sleepy, well, fix the sleep first so you don't need this stuff. But this is a stimulant. Even if you have 1 in the morning, it'll still drive problems with blood pressure later on down the line. Again, it's a trigger. So if you're full of gasoline and I just throw a match at you, that stuff you set on fire. So if you are on the border of hypertension and you have 1 cup in the day, in the morning, it might put you over the edge. So I cut that out. And again, if you're sleepy, find some other stimulant or get more sleep. Last but not least would be number 7. You might need prescriptions. If you need prescriptions to save you, then I don't want you having a stroke. And some people have high blood pressure to the point of headache or chest pain or shortness of breath, dizziness or brain fog. I think it would be important to lower this because it can lead to stroke, so you have to be very careful. Temporarily at least, hopefully a low end, but there's a protocol that doctors use and cardiologists use to initiate antihypertensive treatment. So depending on your race, depending on your weight, depending on other medical problems, it'd be important to get the prescriptions. But don't stop there. If you get the prescriptions and you're controlled, that means 130/80 the majority of the day. Cool, but work on other things too, like decrease your deficiencies. I think vitamin D can be useful. There are some not so great studies that show a low vitamin D can result in high blood pressure. Low iodine, low magnesium, I think they're all important. Fixed deficiency. And one deficiency that we all need is omega-3. If you are on a plant-based diet or a standard American diet or restrictive, I think that omega-3 is important because there's way too many omega-6s And omega-6s are inflammatory. Omega-3s are anti-inflammatory. So if you balance it out, it should help. So I just posted on, I can't remember if it was Facebook or not, but the amount of bottles I take every day, and it's huge as far as not bottles of prescriptions, but bottles of supplements. And I only treat deficiency. So taking a whole bunch of other ones that aren't proven as being deficient, I have a problem with that. But I think at least treat your deficiencies, and you should be able to, if there's a deficiency or two or three that are not taken care of, they might put you over the edge as far as high blood pressure. So taking care of your usual deficiencies, dependent on your diet. I always want you to do diet first, but sometimes if you're trying to lose weight, I can't have you force too many calories in just to take care of deficiency, so I might just take a pill for the meantime. So last but not least, hormones. So a lot of my patients that are concerned about high blood pressure are probably in their 40s to 50s. And wouldn't you know it, testosterone and estrogen and progesterone decrease at that age group. So in some cases, if you've done everything else and you're still having stubborn hypertension, sometimes it's the hormone. And the hormone of choice for men is usually going to be testosterone. Hormone of choice for women is usually going to be estrogen, maybe a little testosterone. But sometimes when you are low on those things, the cells in the body, the brain, the heart, muscle, blood vessel, the cells act a little bit older, and older usually means stiff. And when you have stiff blood vessels, stiff muscle, it tends to make blood pressure increase. If you have pliable stuff, neuroprotective things going on up here, cardioprotective things going on over here, muscle is responsive to exercise, then sometimes things are loose. And when you have loose everything, the blood pressure drops. So it might just be that. I would still say if we have to take care of hormone deficiency, that you work on lifestyle change so that eventually get you off of the hormone creams and the hormone pills. But during that time that we are trying to find a really good dial in, a really good lifestyle, sometimes by getting you to feel youthful with the right amount of testosterone, estrogen, progesterone, DHEA, it might work to your advantage in the short run to get you to that goal faster. And then we pull you off of that stuff if it's covered by insurance, and then your efforts of exercise, fat wasting, muscle building have all paid off, because that should sustain you in addition to relaxation practice, exercise, and everything I just mentioned. So Fran, hopefully this gives you an idea about what to do in addition to doing what we're talking about already. Thank God nothing's happened, but we still have a little bit of work. So those of you who have been successful with a certain supplement, I'd like to hear about it, or finding a relaxation practice, I'd like to hear about it, or your exercise routine. Please post them in the comments down below. Otherwise, I'll see you at the next Minute Clinic. And happy holiday.